Several healthcare workers protested potential Medicaid cuts outside of an event for Representative Michael Baumgardner this afternoon. We heard the newly elected congressman say at his town hall earlier this week that Medicaid would remain untouched, though he did vote to approve a budget that would call on the committee that has jurisdiction over Medicaid and Medicare to cut $880 billion over the next 10 years. This budget has not passed in the Senate. While the budget doesn't explicitly talk about Medicaid, this has sparked fear in our community.
Senator Maria Cantwell held a roundtable discussion with local health care providers and patients this afternoon here in Spokane to talk about the potential impacts of these cuts. Marissa Rio joins us in the studio. And Marissa, you were at that roundtable, so what are some of the concerns from our community?
Well, Derek, if these cuts did ever happen, they're worried about how many people would lose coverage. If you look here, as of June 2024, 54% of kids in Eastern Washington were enrolled in Medicaid, and 22% of adults in Eastern Washington were enrolled in Medicaid. That's over 237,000 people in this area alone.
All these people are going to be sick, and they're going to have to go to nursing homes. Well, who's going to pay for the nursing home? That's Medicare and that's Medicaid. Are we just left to die?
These are the types of concerns that were raised during Senator Cantwell's roundtable. According to the Washington State Health Care Authority, nearly 2 million people in Washington rely on Medicaid to help them with their health care costs.
I'm really scared to know whether I'm going to wake up tomorrow morning and know if I have Medicaid or if I have Medicare.
Gail Helverson is one of those people. She said without Medicaid, she wouldn't be alive.
I wouldn't be able to see the cardiologist or the eye doctor or the any doctor for that matter, because I couldn't afford it. I mean, my Social Security isn't that much.
One healthcare provider said she fears that cuts to Medicaid would lead to closures of smaller healthcare centers in rural areas. She said this would impact more than just patients.
About 30% of our staff would be potentially in a layoff situation. Many of them cannot travel into Spokane or the surrounding areas for employment, so they would probably become an uninsured patient as well.
A WSU official said their medical students train at rural hospitals, and without these experiences,
it would be significantly harder for us to train our future workforce for patients across the state.
If you want to check our work, take your phone out and scan this QR code with your camera. It will take you to our website where you can see all of the numbers we used for this story. If you missed that QR code, you can also find the story pinned on our website, kxly.com. In studio, Marissa Rio for News Now.